Hi, Kevin Henry here today in New York City. It's Greater New York Dental Meeting. I'm here with my friend Anastasia Turchetta. And we're going to talk a little bit about a subject today that is not the most comfortable subject, but still it's one that needs to be discussed. And that's the link between oral sex and oral cancer.
Yes.
And tell me a little bit about some of the research you've done and some of the numbers about that.
Kevin, I'm amazed at how many, as far as statistics go, HPV is related to oral cancer. A lot of people are not relating the fact that oral sex is related to HPV. So therefore, it's our job to educate them more. And I find a lot of times it's such a taboo subject because people don't want to, they feel embarrassed about asking a patient. However, in our profession, it's our job to tell our patients what the risk factors are. So instead of it being just smoking and alcohol as major risk factors, we're finding the numbers with oral cancer are not decreasing, they're increasing. So finding with the latest research, I believe it's between 15 to 20% of oral cancer related are all related to HPV.
So how do you bring up this subject? How are you telling people that, yeah, you need to talk to your patients about it, but they clam up? How do you get them past that point?
I think it's really great to start from a health history standpoint. And you really need to have the talk with your child, and sometimes that's very difficult. And so there could be a conflict with us as dental professionals to address it with obviously a 12-year-old or 14-year-old, because that's where Gardasil, which is basically it's for HPV protection against cervical cancer for young women. So I think if you're a dental professional, what would be awesome is to start with the parent and educating during your oral cancer screenings and stating what the risk factors are. Then letting them know also that this is what's happening with our younger group, our young teens, our individuals in their early 20s. So if you address it from a standpoint, a professional standpoint with oral cancer, I really think we're going to see a difference.
And I think a lot of people think oral cancer, they think middle age, but really we're seeing that go down, down, down as far as age goes. Is that right?
Yes, absolutely. So they're targeting between 12 to 14-year-olds, but now they're also targeting because the stat is if you have more or 5 sexual partners, it increases your risk between getting HPV and then obviously transmitting that to your partner, and then, you know, give or take, it may develop into oral cancer. So it can happen at any age, but a lot of kids think that oral sex is safe sex, and the reason for it is because you can't get pregnant. So we need to alter that mind shift and educate individuals on what the risk factors are.
And when you talk education, what do you see the role as the dentist, the hygienist, and the assistant in this process?
The role for the dentist is to educate your team in what you want in the philosophy, meaning it isn't just screenings with your eyes. Because if you think about it, we can't see high blood pressure, we can't see periodontal disease and just even know what it is just with our eyes. We need to do more. So there's screenings and technology out there to help us chairside. I think as dental assistants, definitely have the conversation with your patient. Whatever you have chairside, it could be a pamphlet, it could be something on a video that you may have in the office. Definitely get these screenings once a year, because as we all know, cancer doesn't have an age, it doesn't have a race, it doesn't have, it has a face, and that's everyone. So it's really important that we take that extra role and educate. It's not a taboo subject, it's something that could save your life.
And I know this is something you've talked about on a new website that you've started and also a new YouTube channel. So
yes.
Tell everybody about what you're doing with this.
Oh, well, it's called Hump Day Happenings. And what that is, it's delivered every single Wednesday. And I wanted to do a video blog basically for the consumers. So I asked them to visit humpdayhappenings.com, ask me an oral health related question, and I'll answer it for them the next week. And I was very surprised about dental anxiety, the relationship again between the oral sex and oral cancer. Next week it's about a website, and I never even thought that individuals would be that interested in wanting to know. So I love being that liaison. And again, it's Hump Day Happening. So,
well, again, the website's www.humpdayhappenings.com, and again, have that conversation. It may be a little bit uncomfortable, but if we're truly going to put the brakes on oral cancer, we need to suggest to people that they check out every possible way that they're going to be subject to oral cancer, right?
Oh, absolutely. For something that seems so taboo, and honestly, it could save your life. And if you knew the statistics and you knew how many people are struggling and surviving, it's time. It's just simply time.
Thanks for your time, Anastasia. I appreciate it.
Thanks, Kevin.